Hi, I'm Dr. David Kolko. I'm professor of psychiatry, pediatrics, psychology, and clinical and translational science at the University of Pittsburgh. And I'd like to talk to you today about something we call TIGAR, which stands for Tracking Individualized Goal Achievement Reports. Imagine this scenario. A mother walks into an outpatient mental health clinic and she says that she wants help because her 7-year-old son's behavior is bad. She sees a counselor who asks her to explain, what she means by bad. Mom says he's got a bad attitude and he never listens. The counselor then spends 10 minutes trying to learn, what she means by those terms, and eventually asks her to fill out a checklist. Checklist has a lot of different terms, 50 different behaviors like crying, toileting, feeling sad, and other behaviors or emotional problems. She fills out the form, and then at the end of the interview, kind of frustrated, she tells the counselor, look, my child fights with his sister all the time, everywhere, including at church, and he never listens to me when I tell him to stop. Now, in the behavioral health field, figuring out first, what is the main problem that the client wants to change? And second, when has that problem changed to the point where it is at an acceptable level for the client? Those are both very significant challenges. Now, one emerging development in health and behavioral health is a focus on personalized care regimens to optimize the impact and the continuity of care across life transitions. Although many standard clinical assessments are available, those tools usually use long and complicated rating scales with lots of items that may or may not capture a patient's treatment needs or goals. They're also pretty costly. They require pretty extensive scoring keys, sometimes automation for programming, and they need interpretation. So they're not often used by participants. Now, our research here at the University of Pittsburgh over the last 25 years has shown that personalization of behavioral health goals may actually help to promote focused, accountable, and effective intervention through enhanced self-management. And we have a number of studies which you could look at that document the impact of intervention on individualized goals.
Take, for example, the family that we talked about in the beginning of this film. The mother came in discussing issues with her child's aggression. The therapist then would narrow down what that aggression looked like. And there we get current problem number 1, daily fighting with sister. And there we have our baseline for treatment. No improvement or daily fighting, and more than once. Then the therapist will ask, well, what would be terrific, exceptional improvement for the child? And the parent would then say that there would be no fighting, there would not be any fighting at all through the week. The clinician would then ask, what would be an acceptable level of improvement for your child? The parent might then say, fighting between 1 to 2 times per week. And then we would go to 3. What would be an expected level of improvement? Fighting between 3 and 4 times a week. Finally, moving down to number 2, the clinician would ask, what would be less than expected improvement? The parent might then say 5 to 6 times a week. Having created these 5 levels, the parent and clinician have clarified what is to be expected of the child. They have identified goal indicators of what levels are accepted and have explicitly stated levels of progress.
So our team has proposed a mobile application, an app to overcome these problems and provide a more tailored and individualized assessment tool that can both better match client problems to procedures or programs and evaluate the ongoing effectiveness of those procedures or programs. It would allow for personalized targets and progress indicators. It would use a mobile app and it would include a provider portal to allow them to exchange information. Now, by allowing the client and the treatment provider to, mutually determine the most important problems to be solved, that provides a framework for tracking improvement on a regular basis. And it allows both the client and the provider to track performance information collaboratively, which essentially allows them to know to what extent are those personalized problems improving, and are they improving to the degree the client wants them to. Then, of course, we can use that information effectively to decide what treatments to use or what treatments to change. We also think this has potential for funding. We have used this app, not the app, but we've used the precursor to it, which is basically either a hard copy or an Excel spreadsheet, in 7 randomized clinical trials funded by the National Institute of Health. They have always shown improvements relative to standardized scales, and we think this is also something which government and other organizations would be interested in funding and supporting. And so if you're interested in this particular app and learning more about it, I would welcome your contacting me. Again, my name is David Kolko. It's spelled Kolko. I look forward to hearing from you. Thank you.